Hi, my name's Kim Horsford. I'm the Chief Executive of Invicta Health, and our pilot is called Integrated South Kent Coast. Our most popular and best loved innovation has been the paramedic visiting. That has involved us working quite closely with our ambulance trust and our practices, develop shared working so that the paramedics can go out and see patients who have urgent visits on the day. And it's quite slow to start, but it took off pretty well up to Christmas and beyond. And the paramedic goes out with a request from the GP with some background information. They visit patients at home, they call the GP back, they discuss the patient with the GP, and together they develop a care plan. And sometimes the paramedic's able to look after the patient at home, sometimes they are able to send the patient to other care somewhere, sometimes they even take the patient to see the GP at the practice. But the end result is that the patient is kept at home in the community and doesn't have to go to A&E. And there's quite a high percentage of our patients that we manage to keep at home, and I think that's something to be very proud of. It was a combination of hard work and established relationships that got this off the ground. We'd already had a very good working relationship with the Ambulance Trust from previous projects, so that was very helpful. We had our Federation of GPs in place, and it was a question then of spending time with both sides to work out a common protocol, a way of working that both were happy with, and putting systems in place and then just signing an agreement. And then once we had done that and set everything in motion, it was a question of getting everybody to sit down regularly, review what we had done, what was working, what wasn't working, and also giving the clinicians involved quite a bit of freedom to say, we think this would be a good thing. So, for example, the paramedic saying, actually, we'd like the freedom to go back and visit patients again independently so that we can check up on them. And so they do that routinely now, so they'll often pop in over a weekend, make sure a patient's okay, not deteriorating, and that they don't need to call somebody else out over the weekend. I think benefits to the patients obviously are being looked after at home, a very speedy service as well, because often the paramedic can get there very fast, much faster than the GP could. The other benefit to patients is that those back at the practice waiting to see a GP haven't had their appointment disrupted, because quite often if an urgent visit comes in, a GP has to drop everything, dash out to see the patient, come back again. In this way the GP can carry on in their normal surgery, maybe just taking a phone call rather than having to be out of the building for half an hour or more. I think it is talk to the people who do the work, talk to the doctors, the clinicians, the paramedics. Don't sort of design it on your own. Involve the people who are going to be doing the work. And I think it's be brave and try something that you don't know whether it will work. Just see how it goes and keep revising it, reviewing it as you go along.